The course Teaching and Learning in Healthcare, taught by Marilyn Raymond and Ben Clark, offers physical therapists with a unique understanding of how teaching and learning theories can be applied to patient care and education, and how these concepts allow us to become better teachers. The course emphasizes on the role of physical therapists as educators to bring about positive health behavior change and self-efficacy. Other concepts, such as adult learning theories, teaching strategies used in various settings, leadership styles, principles of motor learning, and updates on teaching tools utilized in healthcare are also discussed during the course. Learning is facilitated not only through stipulated reading and a discussion board, but also through thought-provoking assignments. Overall, the course content is apt for a great learning experience, not only for the novice, but also the experienced clinician.
Hi everyone. I want to thank our instructors for the course, Ben and Marlon, for their guidance and encouragement. Frankly, in the beginning, I had doubts concerning the course's importance to me as a physical therapist, but as we went through the curriculum, I realized how useful it is to our work. Our profession is a continuous process of teaching concepts and behaviors to patients, as well as learning and integrating new trends of management into our practice. Knowing the theories explaining the steps and the rules that govern teaching and learning was very beneficial. It gave me a solid background and a roadmap to use in teaching patients and colleagues. The philosophy of active learning was new to me, and through the course I realized how effective it is in getting me to work hard to learn instead of waiting to receive the information from a lecturer. I think this course is necessary to everyone who is involved in teaching adults in general, and especially medical field professionals. Thank you.
Hello everyone. I'm here to share my thoughts about the Teaching and Learning in Healthcare course. This course helped me to understand a client's behavior towards therapy, like readiness of a client and his opinion towards change. Different strategies and concepts that are taught in this course have helped me better evaluate the patient's condition. I learned how to make the patient aware of his condition and make him a part of the plan of care. The course required a lot of self-assessment, which improved my concepts of teaching and interaction with my patients. The questionnaires that were given as weekly assignments help me notice areas that can be improved. Tools like discussion board provide a convenient and effective way to discuss different teaching and learning techniques, and gives information about how other physical therapists are using these concepts in their practice and noticing changes in patients' behavior. The principles being taught in this course are important for a physical therapist because we are the ones who spend more time with the patient than any other medical professional. Long-term progress in patients' condition can only be achieved by their cooperation. This course doesn't teach you tricks, but it shows you facts and make you understand what a patient must be thinking about therapy and how you can help him change for good. The best part is, while going through this course, you make your own examples by applying concepts which you have studied in the course. This course helps you to make your own teaching and learning framework, like concept mapping. This is what you can use in your daily practice. Thanks for listening.
Teaching and Learning for Physical Therapists was an excellent course. The material presented in a good way that we can use it in our daily practice. As a physical therapist, we incorporate teaching in our daily practice for our patients, their families, fellow physical therapist assistant, as well as students. It's important for us to know what their learning style, so we will be able to deliver the knowledge in a good way and a correct way, and make it an exciting way of knowledge and not boring one. In the beginning of this course, my personal teaching experiences were limited to listening to my patients, give positive encouragement, and correcting wrong tasks. However, now I think I gained a lot of knowledge to attract my patient's attention, and how to use and correct my behavior while teaching my patient, and how to make my patient able to remember the task according to his learning preferences.
When I think of teaching and learning, so many things comes to my mind. I consider teaching and learning as two sides of a coin, and both processes should work together with each other. I am Philip Thomas, a physical therapist doing the course PT 6400 Teaching and Learning in Healthcare as a part of the Transitional Doctorate Program in Physical Therapy. The teaching and learning has an important role to perform in everyday physical therapy practice. Every physical therapist is involved in some aspects of teaching and learning in his or her professional activities. The understanding of the patient-practitioner collaborative model helped me to focus the interventions on patients' needs and improve the patient's adherence to the treatment. The knowledge of the domains of the learning styles, and the health behavioral changes assisted me in developing adherence strategies to the patients towards therapeutic exercises and towards the initiation of voluntary exercise programs. The course material also helped in the self-assessment of personal learning, leadership, and conflict management skills. It also helped to identify the barriers that limit the teaching and learning experience, which in turn helped to enhance the teaching and learning processes. The Teaching and Learning in Healthcare course helps a physical therapist to become better clinicians and educators with a significant change in our ability to perceive, understand, and deliver knowledge, insight, and skills to the society. When I look back, my philosophy of teaching and learning prior to doing this course was based on the following principles. 1. Creation of an environment favorable for learning. 2. The use of communication strategies with the patient to understand about the patient and develop personalized treatment plans. 3. Use of current evidence-based information in the treatment. 4. Improve the quality of teaching using feedback. 5. The learner should be passionate about the subject of learning and should engage in creative discussions. I hope to use the newly acquired knowledge about the teaching and learning on the foundation of my personal teaching and learning principles to enhance my skills as a physical therapist. Thank you for listening.
This is Dheeraj. In physical therapy, teaching and learning is a lifelong process. This course helped me to explore my personal teaching style, develop a rational and approach to teaching based on the reading, critical reflection on one's own practice, and discussing teaching issues with others. Teaching and learning principles are important to understand the effects of particular teaching practices on learning. They demonstrated the ability to negotiate physical therapy interventions with clients and caregivers and to adapt to the plan of care to meet patients' and families' unique healthcare needs. This course will help future students to understand and experience various models of instructional design and development. It offers a systematic approach to designing, implementing, and evaluating effective teaching learning experiences. It is designed to enhance skills of both educators and learners in physical therapy. Thank you.
Hi everybody, I'm Sudhi Khurana, a physical therapist specializing in women's health. The material presented in this course was very relevant and interesting to the clinical practice of physical therapy. I have benefited from the theories and thoughts on hand, not only as a practitioner, but also as a person. After reading and comprehending the concepts presented in this course, I have altered my clinical skills while instructing patients and students. I try to provide more augmented feedback and give a chance to promote reflection. Now knowing how important this is to enhance learning and skill, I would suggest this course to others as it is a great opportunity to introspect and reflect on the individual practice methods and hence develop expertise as a professional and a teacher, a role that we play all the time as therapists. I have most significantly learned and developed the tool of self-efficacy in behavior modification and have noticed how in my practice the patient adherence to therapy and home exercise program increased when I paid more attention to this tool. Thank you for your time.